Good morning, good afternoon, everybody. I'm Taiwan Swarm from GSMA APAC, heading the APAC 5G industry community. So welcome to join our first healthcare industry interest group. So this is a workshop. So welcome to post your question in the Q&A box. We will try to answer you online or follow up with you offline. So this workshop provides simultaneous translation on Mandarin. You can select the Chinese channel in the Zoom menu. Today, we have a very good line of speakers from APAC, Europe, and American. So after my quick introduction, we will have a keynote speaker, Professor Shafi Ahmed. He's a multi-award winning surgeon, teacher, futurist, innovator, and entrepreneur. He's also taking different advisor role in our government in Europe and Middle East. So he will give you a keynote about how 5G and IoT will transform the healthcare section. Next, we have a pair of speakers on a fireside chat, which is from Vodafone and Deloitte. So recently, they formed a very strategic alliance. They want to have a strong ambition to support European digital health with 5G. So we are really looking forward to learning from them. And then next, we have two slots, which is coming from innovator in American and also China. So Sam will talk about how he developed a contact feed healthcare monitoring solution, which can be applied in hospital and also home care. And then we also have Dr. Torin, who will talk about how he built a smart hospital for unmanned pharmacy in China. So finally, we also have a very good ecosystem panel coming from the Southeast Asia region with Malaysian and also Singapore innovator and also government agency. So they will talk about how to accelerate digital transformation in policy, technology, and partnership perspective. So let me start. If you don't know about GSMA, we are a mobile industry association with presence over 200 markets. We have over 1,000 members to work together with us to drive the industry. And also we have a very good relationship with government. Every year we host very big mobile industry conference, MWC, at Barcelona, Shanghai, Los Angeles, and Africa. In the region APAC, we also have our Mobile 360. This year, we will host in Singapore on August time. Hopefully, we can see you physically in Singapore. So about 5G, this technology already rolled out since 2019. At the end of last Q3, there are already over 172 mobile operators roll out 5G across 68 markets. And then in the region APAC, we also have more than 15 markets roll out 5G, including Thailand, Philippines, Singapore, Indonesia, and recently we also have Malaysia roll out 5G. So APAC is a very, very huge market with great opportunity, but also very fragmented. In order to support this, we work together with our contributor member, including mobile operator, government agency in different countries, technology provider, and also leading domain enterprise to set up this community in order to support 3 different industries to adopt 5G for their digital transformation. This year, we would like to focus on manufacturing, logistics, port and transportation, and also very important health sector, which is healthcare. So in our community, we already supporting enterprise to understanding the 5G, how they deploy POC, justify their investment and get value on top of the technology. And for the innovator, they are also very active, try to find out what the opportunity with 5G, how to advance the existing solution to support different sector for digital transformation. Hopefully, they can also get scale up in the region. So most of you already our member, you already receive our regular newsletter and also able to access our industry interest group like today, the healthcare one. If you miss any this kind of activity, you can go back to our website to visit these resources, which can help you to understand the technology. Looking forward, we also have a year of activity planned ahead. After this healthcare workshop, we have the MWC Barcelona. So we will publish some APAC innovative case study, including healthcare. And then on next month, we also have another manufacturing workshop. This time we will invite Indonesia to take the lead, talking about how leading ASEAN to one industry 4.0 with data-driven. So the community is really open for every one of you, which is free. So the best of you, of course, you can get speaking opportunity, showcases, and also business matching or contributing to our case study and industry report. And then the best of the best, we really encourage you to participate and compete in the Global Mobile Award, which is the GOMO, just like the Oscar in the mobile industry. So now let's talk about the healthcare sector. Let's look at some overview. So digitalization in healthcare services have been promulgated by the WHO since 2005. There are already more than 120 countries develop policy to support this. So APAC, we see 10 Southeast Asia countries working together to define the ASEAN Digital Master Plan 2025. And they also put digital health as one of the priority to support. So if you look at some figure, actually there are still huge resources gap in ASEAN in terms of the number of physicians, the hospital bed compared to the world average. So there is some support is required in order to fulfill the gap. And also we believe digital health can help to provide more equitable, affordable, and also accessible services to the people in the region. It could also satisfy the rising demand for better healthcare services because of more middle class in the region, and also address the burden for the aging population. We believe digital health really can elevate the COVID-19 impact to the existing healthcare system and resources. So there are a lot of opportunity for using the technology for digital transformation. We see there are significant growth in the coming years. If you look at some figure here, there are already 99% of healthcare organizations going through some stage of digital transformation. And the market opportunity is very big, coming from existing 174 billion to 385 billion by 2025. And the compound annual growth rate is also very promising. If you look at the remote healthcare and telemedicine, they are more than 70% and 30% respectively. So another analysis from McKinsey, they also find that the major portion of the digital health will be coming from telemedicine, remote monitoring, and digital pharmacy. So the strong reason behind is the COVID-19 really underscored the need for digital health, especially large-scale lockdown, minimize the amount of person-to-person contact. So for example, we're already seeing patients with chronic diseases in a stable condition. They can benefit from the safety and ease of having teleconsulting, and then the medicine can be delivered to their doorstep instead of need to waiting hours at the hospital. So this initiative were already promoted by Indonesian, Malaysian, and also Philippine government amid the pandemic time. So 5G is not only a technology designed for use by consumer at the hand. So it really a technology very powerful for shaping different industry, including healthcare. So with powerful 5G feature like enhanced mobile broadband, which allow gigabit throughput, much better coverage beyond 4G and Wi-Fi. It means higher resolution medical image, large volume file can be transferred very quickly for computational processing, for intelligence, diagnostic and analysis. Telemedicine also means higher definition virtual consultation become possible. Remote patient monitoring with more medical device connected for vital signs or behavior monitoring. And also there are also augmented pharmacy is also possible with 5G enabled AI robot, and physician training can be enhanced using the AR technology, and also therapy using AR as well. So for ultra reliable low latency communication, which means very low latency down to single second, down to single millisecond. It means remote expert right now can collaborate in a surgery, not necessarily physically person in the operation room. It also means more robot drones, AGV, because 5G support high density of robot for different functions, such as surveillance, disinfection, or delivery. And also connected ambulance for emergency is also possible with remote diagnosis support. Finally, massive tight communication, which allow millions of high density devices connected per square kilometer. It means that smart hospital become possible with massive coverage. A lot of data machine can be connected to enhance the operational excellence, more process automation, monitoring, energy management, and access traceability. So 5G enabled healthcare is already available, and it already deployed in different scenarios in hospital, in medical center, in connected ambulance, in GP, and also in caring center or nursing home, or even home care, or even for pharmacy, life, and science research. So GSMA already working with our member to define how to deploy 5G in different scenarios in private network, public network, or hybrid network. So welcome to download all this paper. So finally, I want to share you a good news. So in the region, we're already seeing digital pioneer in North Asia and Southeast Asia. They're already using the 5G technology to deploy in the healthcare sector. So in this year, we also see some of our innovators in the region got shortlisted for the final GOMO award. So for example, Sirit Raf Hospital in Thailand, they are one of the final 5 shortlisted. So now let me introduce the next speaker, Professor Shafi. So as I mentioned, he have multi-position in different organizations. So today he also represents Vodafone as an ambassador, talk about connected health. So he's also the Chief Medical Officer from Medical Reality. He's also the consultant surgeon and also the member of the NHS Assembly. So welcome, Professor Shafi.
Good morning, and thank you so much for the kind introduction. I'm just going to share my screen, and then we can start the talk. Thank you so much. Right, I hope everyone can see my screen.
Yes.
So thank you so much, Terence. It's a pleasure to be here, and I'm going to spend the next 20 minutes or so just talking to you about where the future of healthcare interspersed with how 5G is enabling us to really reimagine the way we deliver healthcare, not just in the UK, but across the world, and some examples of where 5G has transformed the way we think about health and care for our patients. So the first thing to say, of course, is not to think about 5G in isolation. 5G is an enabler. It's the connectivity that allows us to shape the other technologies that we have seen over the last decade come to fruition. Healthcare is the one vertical where all of these technologies again transform the way we deliver care, whether it's nanobiotechnology, whether it's immersive technologies like AR and VR or mixed reality, the whole big data, the Internet of Things, or what we call the Internet of Medical Things, were powered by, of course, 5G connectivity, as well as wearables, sensors, nanotech, holograms, etc. It's an amazing time to be alive in medicine. There's so much availability of technology that has enormous potential. So it's for us to now realize, how do we use this convergence to our benefit to improve diagnostics, treatment, management, and of course, care in the community. When 5G was kind of introduced a while ago, I came out with a statement. I said that basically what 5G is, it's a covalent bond, connecting the molecules of exponential technologies of the fourth health revolution to improve the lives of many. It's the missing piece of the jigsaw that we're looking for with its, of course, fast speed and low latency to allow us to do things that we were dreaming about for many, many years. At Vodafone, of course, it's about designing policy, sharing content, understanding what other people are doing around the world. And we've produced a number of documents out there around the vision around healthcare. And also we have a Connected Health journal that comes out once every 3 months. So please go have a look at those if you can on our website to see what our thoughts are about the use cases and how we're going forward in the world of health. As Terence said, the application of 5G is going to be really a game changer for us in many ways, with its, of course, an immense speed of 2, 3, 4 gigabytes per second and a latency of 0.1 millisecond, which is imperceptible to human perception. It means that actually we can do things in real time. As speed goes up, of course, we're thinking about connected ambulances, looking at remote surgery, using immersive technology to create a new paradigm shift in the way we think about education and health. And of course, looking at the cloud, robots, and drones, etc., as an interface to help us understand this much better. Look at the triad, of course, here. What you see a triad here, of course, is the fact that you've got this ultra high speed, ultra high density, and ultra low latency. You can see how the use cases sit in this kind of triangle of 5G, with, of course, diagnostics and consultation, with telemedicine and remote monitoring being here, ultra low latency part of it, the density used for mass populations or using drones or robots, and of course the ultra high speed allowing this whole concept of remote surgery or remote training and streaming of events. So that's kind of triad you've got to think about when you think about 5G. It's not about 5G, it's also about, of course, edge computing, and that's going to be, of course, transformative in hospitals and primary or secondary care to allow us to do much more at the point of contact. So it's a mixture, of course, of these technologies plus the 5G and edge computing capabilities, and the three go hand in hand. Let's take a minute to think about the healthcare system of the future, what it might look like. We know it's going to be digital. We know it's going to be connected, underpinned by technologies like 5G. It's going to be data-driven, heavily to become personalized in its approach. It'll be integrated, of course, and we think about being patient-centric or empowering the patient to be able to manage their condition at home or in the community. So that's the kind of face, what we're looking at, exacerbated or accelerated by the pandemic. Let's take a look at the hospital of the future. We always think about big, bolder, huge, enormous. Actually, let's think about smart hospitals, maybe smaller, equipped with technology to allow you to navigate through a hospital, understanding where the electronic health record could be connected to your smartphone. You can think about a connected ambulance, smart parking, asset tracking, cameras. So it's going to be a different environment where the hospital becomes smarter and we're able to manage patients more efficiently. That's got to be the key. We waste a lot of bricks and mortar in terms of trying to think about health, but actually we've got to think it in a different way. What about the user interface or the user experience, when we're choosing computing technology? Actually more relevant now, of course, in everyday life. The journey through a hospital might be more easy to navigate, improve the experience using technologies to allow us to navigate safely and to improve the experience and outcomes overall, whether it's critical messaging, using messaging systems across the hospital to communicate rather than bleeps, capturing the information digitally, monitoring performance, etc. So that whole experience should change. But there's been a change in the way we think about health. It's about promoting well-being and remoteness, so that now we're looking at how we create not a hospital, but a hospital, care at the home, care at the house. So now we're seeing remote monitoring using sensors. We're seeing telemedicine or consults being done remotely, supporting loneliness, mental health, and actually using different technologies to allow patients to be more empowered at home. And that's the change. And hopefully the money also will drive this change going into community and social care. It's no surprise that the pandemic has shown us enormous potential for telemedicine. This was a picture from 1924 showing how the futurists 100 years ago were thinking about telemedicine. It's about teletriage, telemedicine, telecare, all interchangeable, about how we manage patients in the community. In the NHS in the UK, 60% of the budget goes to managing chronic diseases. So an awful lot of money. What about if we create healthcare at home so it's more accessible, so that primary care becomes the point of main contact, or in home where patients have wearable sensors to monitor their performance. Here, of course, this is of course in China, where you can see perhaps taking away bricks and mortar, having a 5G enabled cubicle. We could go in and see a doctor or a healthcare professional in 5G technology. Use a smart card, you can pick up the medicines next door. Maybe we'll see a rise of these cubicles or portables, taking away the burden of bricks and mortar and primary care, replacing it with people that can be accessed all the time, 24 hours a day. Maybe those are the kind of solutions that 5G might enable in the future. We talk about chronic disease. Now, I mentioned diabetics, patients with COPD and others are going to be monitored more at home. They've had less appointments over the last 2 years because of the pandemic. They'll be managed differently with home monitoring. This is an image from Time magazine a few years ago, suggesting that we may never be offline in the future. But actually, that enables us to think about this Internet of Medical Things, whether we're thinking about putting implants into the skin to measure your electrolytes, your oxygen levels. The Apple Watch, of course, now measures saturation as well as measuring an ECG for atrial fibrillation. Blood pressure monitoring remotely finally has come out last year. And of course, we've seen the pill cam navigate through a human body, through the intestines and colon and rectum, to be able to analyze and look at risk stratification for cancer. These all can be enabled by 5G, creating a remote monitoring system, of course. We've seen with diabetics, continuous glucose monitoring now being used with various devices. The artificial pancreas is now being sanctioned in the UK, so type 1 diabetics can actually monitor their own disease and illness in real time. Also, we've seen, of course, a live call with the ECG monitors, and now we're seeing bodysuits being put up so that we can measure parameters like blood pressure, pulse, temperature, etc. in real time. Great for long-term conditions, maybe for rehabilitation. Connecting these is a solution for some of our patients, and 5G will enable us that connected healthcare or that Internet of Medical Things to enable us to manage patients in the community. What about emergency care? I think Terence mentioned, I think in APAC, they're doing some smart ambulances, and similar to Europe, of course, where now in real time, perhaps you can connect multiple parameters within the ER in the ambulance itself, using tele-ultrasound, perhaps with AI interfaces, visual recognition, HD calls, having a map and a report that comes out immediately by accessing people remotely. So now here is an example in Milan, where Vodafone worked with the local ambulance authorities using mixed reality. This is a HoloLens 2, being able to see a patient in real time in the golden hour when they're acutely unwell, getting real-time feedback from clinicians in the hospital through a connection. But also they can see the scan, etc., the machines, and make a valuable support in the community or at the point of accident or scene. We mentioned drones earlier, and of course we've seen Vodafone use drones to transport COVID supplies across Scotland using 4G and 5G capability. And I'm sure sooner or later we'll see more and more of these being used. We've seen them being used for transplants, cardiac heart transplants taken from a donor to recipient across the US. We've seen it being used now to transport goods across Africa and also parts of North America and South America. We're seeing how we can connect people and use technology to even improve blood donors across parts of Rwanda and others. Most specialty surgery, of course, is going to go through some immediate changes, because now we're seeing the digital surgery concept come into view, whether it's robots, they're using AI and deep machine learning, computer vision. We're seeing 3D printing. We're seeing smart technologies within the OR capturing valuable data to allow us to personalize the approach to healthcare. So that's going to be very interesting for us as we go forward. What we've seen now, of course, is the AR surgery coming in, remote surgery. This is surgery in 2000, doing a live operation across continents from France to the US. And of course, that was using the old cables and lines. Now we're seeing 5G surgery coming in. And this was in China, of course, about 3 or 4 years ago, using 5G to do remote operation. And we're seeing now the collaboration with Proximi, with Vodafone, allowing you to do remote collaboration and telementoring across the world. So we can see here is a surgeon working remotely.
That's really what we're focusing on by working to develop these platforms.
With Proximi, I've been using it really heavily since May. I was introduced to the technology during COVID. And it's just been a game changer.
So we're seeing remote training. Back in 2014, I used a Google Glass to stream a live operation across the world using essentially a 3G or 4G connection. Now, 8 years later, we're seeing smart glasses like rods and cones, creating a platform, an ecosystem of training. We work with Vodafone using the GigaCube, which is a small device that amplifies signal to 4 or 5G, and working with Johnson & Johnson to be able to live stream surgical operations during COVID, where surgeons, so trainees, could not come to the operating theatre. Therefore, we had to bring the operating theatre to them using these smart technologies. This is me operating and training surgeons across the world using simple devices and platforms to allow us to connect people and to democratize education. Immersive technology is very interesting, of course, with XR, extended reality, encompassing both AR, VR, and mixed reality, and of course, ushering the new ways of working with holograms and avatars. So this virtual world that we're living in is becoming almost in parallel or kind of synchronized with the digital and the physical worlds. This was us 3 or 4 years ago, connecting surgeons across the world as the avatars in real time. And what we're doing here is this was the sort of the VR operation we did back in 2016, where we did the world's first virtual reality operation. This was basically streamed live using technology into a cardboard headset, or it could be any headset. This was back in 2016, remember. Imagine what 5G will enable us to do now. What we're planning to do now is actually doing real-time photoreal theatre with 5G to be transported across the world. So we can actually do something in real time, but it will look absolutely lifelike. So this was an example where I trained 55,000 people in a single day by using connectivity and VR VR technology. What about if you convert education entirely to allow people to use these technologies? Well, I'm pleased to say that, of course, at Coventry University, Vodafone launched the UK's first commercial standalone 5G network. So enabling universities to teach and educate using some of these technologies is the thing that will underpin our imagination, if you like, of how we can teach the next generation across the world. So it's so important to get connectivity right to allow these kind of applications. Now to look really into the future, of course. You've heard a lot of terms being banned about recently by Facebook, changing its name to Meta. And of course, Metaverse is something that I've been working on for a number of years. This digital world that connects to the digital world, the real world. So how do we now think about the metaverse, which I think should be powered by 5G? In fact, I'll be in Dubai next month to do something amazing and launching the Metaversity and also a healthcare city in the metaverse. This was me back in 2017 as my avatar, connecting in real time in the metaverse, way before Facebook had changed its name, because I was thinking, how do I connect people remotely and collaborate? This was me with my HoloLens, my theatre at the Royal London Hospital. And basically I brought in surgeons from around the world, from India at the Tata Memorial, and also from the US. So we're connected together, sharing assets in 3D, so we can all share and experience this world together and offer support, maybe telementoring or teleproctoring, or indeed a remote collaboration. So these are technologies that require huge bandwidth, but actually can be powered by 5G. And now we're seeing much more realistic digital humans being created, the meta-humans, to be able to do that in real life almost, using AI and deep machine learning. So it's kind of the way we're heading towards in the future. In Dubai, a couple of weeks ago, I launched the Metaversity, my concept of actually having remote learning. And we're creating a whole university in the metaverse, which will be ready in about a month's time. I'll launch it at the Knowledge Summit in Dubai. So watch this space. Not only are we launching a university, Metaversity, we're launching a healthcare city, building from scratch and designing a whole industry in the metaverse. We have hospitals lined up already to join us. We've got the architects working on the infrastructure and the user experience. So in March, watch this space. We'll be launching a healthcare city at the Knowledge Summit, where I'll be navigating through what that virtual will look like, and it'll be powered by 5G. Etisalat in Dubai will be supporting this so that we can see how 5G will enable this kind of virtual world. This is me teaching people from, this here is me teaching 8 people from around the world, from the US, from Singapore, from Dubai, from the UK, and other parts, all together at the same point to, again, share those experiences. Let's see what the journey of a clinician could look like. That's like a small journey for us at Vodafone, also to share experiences for others around the world. But obviously, the world that we're living in is about collaboration. The pandemic has allowed us to collaborate on a much wider scale, bringing industry partners into the heart of healthcare, working together to reshape and reimagine the healthcare of the future, underpinned, of course, here by connectivity. So it was a pleasure to have seen the announcement of Vodafone working with Deloitte to global partnerships to work out how to support healthcare over the next few years. So I thought I'd leave that with that, because our next session, I'm really excited to hear from our partners in Vodafone and Deloitte to talk about this Centre for Health across Europe. Hopefully we can get a lot of information and insights to what they're doing going forward. So thank you very much for that. I shall stop share there. And of course, I'm around for a little bit to take any questions on the Q&A. I'll try to answer them myself. So thank you very much, Terence, for the invitation to speak at this conference.
Thanks, Shafi. I think you using the 20 minutes to bring us to the past, persons, and even the future. Really exciting. So now let me introduce Katrina Lowe's, the head of Vodafone Center for Health and with Deloitte, and also Helena Lisa Truck, Vodafone Center for Health with Deloitte, the Deloitte lead. Welcome, Katrina, Helena, over to you.
Thanks, Terence, and it's great to be here, everybody. Really happy to share with you what we're doing from a European perspective, but also to hear from your perspective. So questions and answers in the chat for sure. And I've already seen some requests for some of the materials that Shafi was sharing. So we'll make sure we follow up with some links there. So I think, I guess, question and answer session between Helena and myself to tell you a little bit more about the Vodafone Centre for Health with Deloitte and why we came together. So, you know, Helena, do you want to give us an idea a little bit about what the Alliance is all about?
Absolutely, my pleasure. Good morning, good afternoon, good evening, everybody. Wonderful to be here. It's quite an honor to also share the virtual stage with great experts and talk about our favorite topic, which is 5G and health. Now, what is this whole Vodafone Centre for Health Alliance with Deloitte? Essentially, it is a strategic alliance, and we brought our two parties together and two capabilities from Vodafone experience in connected digital solutions in health, combined with Deloitte healthcare consultancy knowledge and experience, a very large practice. And our objective is to build future-proof solutions to bring back our Europe, out of crisis and enable better access to care. Back to you, Katrina.
So why healthcare and why now? Well, I think particularly around the world, we're seeing many governments making digitalization a really key part of how they want to build back better. The pandemic has really accelerated a lot of challenges that were already underlying in society, but particularly when we look at healthcare, it has really brought to the forefront some of the things that we really have to look at differently. So socio-demographics. In Europe, we've got a largely aging population. Our baby boomers, the largest ever generation that are living past 65, that are going to live maybe 20 years longer than their parents did. But unfortunately, maybe 15 of those 20 years, they will be managing a chronic or multiple chronic diseases. And I think as Shafi just said there in the UK, 60% of the NHS budget is already being spent on critical diseases. Movement of labour around the world is being restricted at the moment. So where we're seeing more young medical talent coming out of Asia, coming out of Africa, at the moment they're restricted from moving to other countries to practice and learn and develop their skills. So in Europe particularly, the European Union has put a significant investment behind the use of digitalization to help economic recovery. So Recovery and Resilience Fund has about 670 billion euros of investment through the national governments into the countries of Europe to invest in things like 5G infrastructure, rural network coverage, open RAN. So there's technology investment as well as investment into areas such as education, agriculture, and of course, health. So for us, we know we're just at the beginning of some of the amazing visionary ideas that Shafi was talking about there, but it's down to us as a technology industry, as a professional services industry, to help our healthcare professionals to really adopt digitalization in a way that makes the biggest difference. And so, as Helena says, Deloitte's professional services, its leading worldwide life sciences capabilities, Vodafone's technology capabilities, our new work in 5G and Edge, we're coming together to try and make sure that we can solve some of the immediate problems today, but build the infrastructure so that we can digitalize and transform as the new technologies become available. So tell us a little bit more, Helena, about what we're, how we're working together. What's Deloitte bringing to the partnership, and why Vodafone?
Absolutely happy to, Katrina. So how do we work together? Maybe I will start by saying this is a long-term journey for both of us, right? Because we know change cannot be done overnight. So we are currently looking at a 5-year partnership between our two companies. What we bring is understanding of the healthcare industry. We have about 25,000 dedicated healthcare professionals, people that understand clinical pathways, people that understand how to implement electronic medical records and adjust it to the way, let's say, intake will happen in the emergency room. So people that are trained clinicians, also trained technologists. Now, on the technology, what makes it so exciting for us working with Vodafone, and actually by Vodafone, is because Vodafone brings the latest and greatest technology capabilities and knowledge, and also R&D capabilities that make these future-proof digital solutions in health happen. If our topic of discussion today is 5G, and as Dr. Shafi pointed out, 5G is the greatest enabler that allows us to take advantage of things like augmented mixed reality, machine learning, using supercomputer power to process massive data sets in a secure way at a fast capacity. So things like this are amazing technologies that we could apply together for good. And the way we work and the way we collaborate, we are solving problems that need to be solved. So, for example, one of the things we are doing right now is we have a proposition factory that is listening to clinicians, listening to the voice of the patients, listening to the voices of administrators in the hospitals, identifying what are the real problems that have to be solved, putting the right basic and the right foundation in place, and of course, taking it to the future to come closer to some of the aspirational use cases that Dr. Shafi was showing us a few minutes ago. So back to you, Katrina.
So we've worked together, Vodafone and Deloitte, for a number of years now, particularly in IoT. And I think, we're very proud that there are more than 20 million connected medical devices around the world that rely on Vodafone IoT connectivity. So we're taking that knowledge, the understanding that although the main cause of the problem is similar. Humans are humans. Every country has a different way of approaching its healthcare system. So we're designing propositions and solutions that are consistent at the core, but have the flexibility to respond to the government regulations, the methods of payment in the country, and some of the socio and economic differences country by country. We're starting in Europe because of the Resilience and Recovery Facility. That's a great accelerator. So Germany, Italy, Spain, and UK are the initial countries that we're focusing on, and then we'll be expanding across Europe and into other territories. But at the heart of all of this, it's how can we take these new technologies, how can we build as much of the capability in a consistent way so that we can scale fast across countries. We don't have to build every time for every network and every country's regulations. And part of what we're doing is working with the governments in the countries, particularly where Vodafone has a network operator license, is to start to talk about policy and how can we change and adapt policy to make sure that technology can bring the full benefits to our citizens as quickly as possible. So how do we think our alliance is going to help society, Helena? This is a big purpose-driven activity for both of us. Tell us a little bit about how we're going to bring benefits in that direction.
Yes, absolutely. As Katrina mentioned, both of our organizations are very much purpose-driven organizations. And even before forming this alliance and announcing it to the market, we were just talking to each other, thinking, how can we make the situation better? How can we ease the burden on the society, especially worsened by the crisis? So example that Shafi was showing was the drone delivery of the test kits in NHS Scotland. That was one of our projects that we've done just to bring the difference, make the difference and solve the problem. And in the drone example, we reduced 48-hour delivery time of the test kit in a rural area in Scotland down to 2 hours. So you could imagine the immediate impact that we provided. Now, we also recognize that there is just quite a wide inequality in the society with access to care, with provisioning to care, with quality of care. So one of the areas that we are focusing on, how can we bring this access? How can we kind of lower the burdens? We are also looking at the population that has, low or limited access to care or protected populations, such as elderly and cognitively disabled ones, by providing some solutions for them, by guiding them through the day and enabling the communication, bringing technologies like telehealth, right, and virtual doctor appointments, bringing that to their homes. A good example also to share is what Vodafone is doing in Greece with a solution called Innovus. And there, the remote patient monitoring and actually doctor is being brought to home with all the digital enablement, digital technology and connection to the patients, and addressing kind of like difficult care access to in islands in Greece, out of all of the rural locations. So again, by combining our forces, we are looking at how can we provide the access better, but we are also looking at experience, and we also fully recognize how overburdened healthcare professionals are currently due to pandemic, and overall we know the shortage, which is kind of a macro problem before even COVID hit us. So we are trying to make sure we bring the easiest experience to reduce the burden, to bring efficiencies into the day, to reduce some of the administrative unnecessary work that needs to happen, to kind of make the life of a clinician a little bit easier and keep them in their profession.
So tell us a little bit more about some of the 5G use cases that we're looking at right now, Helena.
Oh, happy to. Again, it's very difficult for me to say something super new following Dr. Shafi's presentation. It was great. I will just maybe add two or three and explain why it's so important. So I want to add on a little bit on the digital surgery topic, right? I think many of us know about the massive elective procedure backlog in Europe, right? I think in UK it takes what five years to get access to receive the surgery, and 5 years for somebody who is diagnosed with a condition that just simply cannot wait. 5 years means life sometimes, right? So one of the things that we are looking at this moment in time is how can we actually make the digital surgery proposition scalable? And how do we actually, number one, provide access of the specialist surgeons to the surgical room without, all the logistics of traveling, et cetera, but provide the absolute best expertise virtually in a room that, of course, need to be enabled by reliable connectivity such as 5G. You certainly don't want a surgeon to be dropping connection while they're advising how to fix the artery, for example. The other element that we are facing is that the surgical students, the medical students, are really caught in a loop because they didn't have the time and opportunity to practice, to become licensed surgeons. It's so difficult with all of the restrictions. Therefore, leveraging digital surgical capabilities allows them to learn remotely and to actually become ready for conducting the surgery. So this way, we are kind of providing capabilities to become ready and increase the capacity who will perform these surgeries. And of course, the last element is quality, right? And predictability of the procedures. By bringing the digital surgery capability, people are able to learn, they're able to repeat, they're able to follow, they're able to get the guidance, and it can be also done without being physically present in the OR. So that's one of the areas that I find exciting and we are focusing on. And one of the examples I think we have in Germany right now is we have kind of this whole mixed submersive experience for the surgeons to practice when they perform heart transplant surgery, for example, extremely complex. But by actually practicing and being in this submerged mixed reality world, it's possible to, of course, achieve better outcomes.
So I think we've got some really exciting futuristic use cases, but one thing that we're really focused on right now, and we're hearing from those voices, the clinicians, the administrators, the hospital chief executives, is there are so much that everybody would love to be able to do today that they can't. Typically, a hospital is a building that is a Faraday cage. It's built with concrete and steel, and we've got an example at the moment where one hospital has replaced its glass windows with thermodynamic glass to help with energy management, and they've blocked all of the signals coming into the building. So it's not just the very old buildings that are struggling with connectivity. We've got competing forces, if you like, where we're trying to be much more energy efficient. We're trying to make the most of the latest materials that are available. But in doing that, we block some of the other digitalization that happens. And I think as an industry, one of the challenges that we've got to think about is how do we help our healthcare colleagues understand what is possible, but where the investment needs to be made to make that possible a reality. So we're having a lot of conversations about potentially turning hospital campuses into 5G enabled campuses. There's lots of use cases we've seen here, everything from 24/7 autonomous labs, and I think we're going to hear a little bit later about the zero touch pharmacy, everything through to remote access to surgical experience. But none of that's possible unless you've got a really good connectivity infrastructure. That's 5G, that's wired, it's SD-WAN, and it's very, it's your security policy, because we could do some really exciting things with mobile private networks, 5G enabled access to edge computing. But if you're open to a ransomware attack through somebody downloading a cloud application to their laptop, then all of that benefit that we're talking about won't become a reality. So I think there's a huge opportunity for us to join together as a bigger ecosystem partner group. Deloitte and ourselves, we see a lot of benefit by bringing together the transformational professional services with the leading edge connectivity and technology, but also looking at how do we make sure that that infrastructure is strong enough, robust enough to be able to build some of these transformational future use cases. And I think we really are reaching out to policymakers, standard setting bodies, think tanks, anybody that is really shaping the future of where 5G and edge artificial intelligence, where those technologies can take us, make it rooted in where we are today and give everybody a clear path to these fantastic future benefits, because it's our job to translate this technology into ways that healthcare professionals can be more effective, most importantly, can take very scarce resources and make those resources reach further. We can't keep asking doctors and nurses to just see more patients. We know from some of the problems we outlined at the beginning, we've got probably a 5 to 10 year challenge where we can't move people around the world, the population's changing. What can we do as the technology industry, the med tech companies, the software providers, the entrepreneurs, the doctors, the clinicians like Shafi? How do we come together to make this as easy as possible for our healthcare colleagues to really make a difference? Because at the end of the day, it's you and I and our families that are going to benefit here. So we're really excited. I hope you'll watch our progress over in Europe. We will certainly be happy to share updates as we go. But otherwise, big thank you, Helena. Thank you, Shafi, and Terence. We will hand back to you.
Thanks, Helena and Katrina. I think we are really looking forward to your progress. I think APAC actually, especially Southeast Asia, we just start the journey. So I think a lot of practices, your ecosystem is definitely will benefit the APAC development. So there are already some people looking forward to connect you guys for collaboration opportunity. So please check some of the questions in the Q&A boxes. Try to answer. Thank you very much.
Thank you. Goodbye, everybody.
Thank you.
Okay. So now we have next, we have invited Sam Yang, the CEO of Sandra Cardian. He's going to share you about how improving healthcare with continuous contact-free RHR, RR, and motion monitoring. So very interesting, because I suppose everything connected need to be wearable, but now he have a new idea to deploy this kind of healthcare monitoring solution. Over to you, Sam.
Hey, everyone. Great to be here.
Yes.
So one thing is, if I may sound a bit slow, it's because it's 2:52 a.m. for me. I'm based in Toronto.
Yeah.
So
Thanks again for supporting this.
No worries. Pleasure to be here. I actually want to start off by following up what Katrina just said a couple minutes ago. The question, what can we do? Now, that's actually the same question that we asked ourselves when we started this journey. And we said, look, we have access to this amazing technology that it's impulse ultra wideband radar technology. But when the pandemic hit, we asked ourselves, all right, we know we can do contact-free resting heart rate, respiration rate, motion, and presence detection using the sky. But what can we do in the fight against COVID-19? So it goes back to the early days, March of 2020, when we were approached by several large hospitals in the US and said, hey, Sam, there's no vaccine. Our nurses are having difficulty with PPE. They're already being overburdened. we are looking for a non-contact way for them to check in on the patients. Now, this is hospital setting. So that trigger, that actually gave us that motivation to go forward and start a trial. The only problem is we didn't realize that we couldn't do anything until FDA clearance. So we did that, and we became the first company to get this type of monitoring with FDA clearance. Now, so having said that, so why? Why are we doing this? It's, again, there's applications for hospital, long-term care, and home. But after after we got the FDA clearance and everything, we really started to focus on where it can be maximum, like in terms of effectiveness. And that is where accelerating and enabling powerful early detection of illness comes in. So what happens is that in a home setting, radar is much more powerful because it can collect a lot of data accurately, automatically, which means you don't have to worry about it. You're not constantly reminding people, did you wear your wearable today? Did you wear this and that? No, did you charge it up? Did you send the data? You're not gonna get that because people they wanna enjoy their life without constantly being reminded that they need to check in on their health. That's actually very critical for home application. So that's our ultimate mission. But let me give you a bit more information about us. We are a startup, of course. I'm the co-founder and CEO for this company. We started this research 11 years ago, had multiple peer-reviewed publications, and it just kept on leading into multiple areas. And we're very, very proud of our achievements so far. So what is it? Again, just to cover the basics here. So we're sending 15 million impulse signatures per second at a low frequency, 6.5 to 8 gigahertz. And we're coming back with macro, micro, and nano vibration analysis based on the information that our body constantly provides. So if I'm talking and moving, motion index. If I sit still, 30 seconds later, it can hone in and pick up the breathing pattern. And then from there, it can also hone in again on the skin level and pick up the heartbeat motion contraction information. So again, it's FDA clear. The accuracy is plus minus 3.2 compared to EKG sensors in the hospital. Compared to an Untitled CO2 mask is plus minus 1.18. Extreme accuracy. It can place anywhere in the room. The type of data that we can get is very, very detailed, as I mentioned before, including respiratory waveform, all the information that we can get. Now, I want to also point out to this, why then are we talking, am I even here, right? So it's all about that raw data that we can collect with this sensor, but the ability to tie that with 5G. So even in a hospital, the way that you have collection of data is, in the collection of vital sign, is that in intensive care unit, you have patients that are all wired up. Sure, they can get continuously monitored, but in general, where most people are, they only get checked every 4 to 6 hours by a nurse coming in. And so when they come in, they look at your chest motion going up and down, they'll multiply it by 3 for after 20 seconds and get a number. But that's basically 4 times a day, 4 times in 24 hours of measurement. We're collecting every single time that you're about 90% still, we collect this type of number, 8,406 times, for example. So what can we do with this type of information? Well, here's one example that we found that this is extremely powerful. In this particular skilled nursing facility setting, we found out that on December 29th to, November 29th to December 1st, we had consistent elevation of resting heart rate and breathing for 72 hours. It peaked at 30 breaths per minute. Unfortunately, this person had to be rushed to emergency on an ambulance. So that 3-day period, that was that main cycle where the body, our body was telling that, hey, there's something wrong here. I need help. I'm breathing 20 times, 23 times, 24. And we all know this because of COVID-19, shortness of breath, right? Now, here's what's more interesting. Before this obvious event for 72 hours, we start to notice only resting heart rate spikes. Now, this is not normal. Even in a hospital, EKG sensors have distortions when you move. But again, with radar, you don't have that distortion. So for about several hours a day, we were noticing spikes of resting heart rate, even though this person, again, was just laying down in bed resting. And we noticed the spikes. These are earlier indication of deterioration that we can detect. So then all of this put together, we decided to focus on what can we do to make this possible from home. So of course we are FDA cleared for home use, but we wanted to use this. So after some trials, we decided, hey, Wi-Fi is not going to cut it. I think Helena also mentioned, when it comes to health, you don't want to have any kind of, I guess, a situation where the data doesn't come in properly. You want to make sure that the data is correct. It doesn't use AI, I'll get that in a bit. And it's going to be consistent, reliable, accurate information that is flowing in real time. So although we have API, REST API, we also have WebSocket connections so that to just constantly push real-time data. So it's all about proactive care, not reactive care, meaning we're not designing to react based on someone deteriorating, based on someone falling, so having 30 breaths per minute. We're basically saying, hey, what's going on here? These are all the signatures that are showing that signs of deterioration for this person, and proactively provide treatment early on, whether it's medication or treatment or just taking the person back to hospital, not into emergency, but as a check-in. So there's all kinds of benefits from health, less strain on the staff. This is very important, whether it's a long-term care or hospital. 63% of preventable deaths are attributed to failure to rescue because of inability to monitor continuously. Now, this is within the hospital. It's quite interesting. 60% of patients are not continuously monitored. It's just very difficult to do this. In home care as well, as I mentioned before. And really the biggest thing here is peace of mind. Peace of mind for family members, the staff, and the users. And then, we're just talking about the vital sign, but we can also do behavioral health, gastroenterology, fall detection, sleep. So it is very important. Sleep is also important if you are trying to investigate pain. So if a patient has been in sort of a treatment and surgery, chemotherapy, cancer therapy, whatever it is, they want to make sure, hey, how is that person reacting? Are they coughing more during the sleep? Are they tossing and turning during the sleep? How many number of resting heart rate are we collecting? Because if you constantly move, you get less number of detection. So these are all things that we can do. And so we are able to provide this. Now, the whole key point here again is not really necessarily about promoting our company here. No, it's about the possibility of now engaging, even for us, engaging with the technology that we have developed, pair it with 5G technology, and create a whole different digital revolution, disruption, if you may say, in this space. And so it's going to be very powerful as we move forward in terms of what's post, I guess, pandemic era, where a lot of the focus and attention is now saying hospital in a home. They want to make sure that they can control health and provide treatment early on so that the hospitals, the healthcare systems don't get overwhelmed for any kind of next potential type of epidemic or pandemic or things like that. So it is a win-win for the government, for insurance companies, for users, for telco companies, healthcare providers. There's reimbursements as well. So that is, I think, very important for all of us to pay attention to. So these are some of the information that we can share. This is my contact information for anyone that wants to find out. One last thing I want to say, I think I remember in the question section that what about AI? AI into the healthcare field. Now, for us, we are, again, very proud of not using AI to do the collection part. In fact, everything is edge computing. So we don't even need internet connection, to be honest, to process it. We do need an internet connection to send all of the processed data over for analyzing. But there's a difference between statistical analysis and AI. So it has to be in a format where all of this massive amount of really great information that we're collecting and process in an AI engine so that it's all about longitudinal predictive health monitoring. So as I mentioned to you, the graph, that's statistical. You know, anyone can see the continuous elevation of deterioration happening and say, wait a minute, that's not normal. That's a trend alert. But the previous 7 days, it's very difficult to see, wait a minute, those spikes, what does that mean? You know, that could mean different things for different people with different conditions, different age group, different BMI, whatever it is. So we need more information, more learning from an AI perspective, and finding out what those biomarker signatures mean to a certain type of group of people. So that is something that we're working on now. And it is a field that many other companies are now starting to get into. What was the cause? You know, did this person have a change in their diet, change in their medication? And did that cause a certain type of reaction? All of those information has to be studied together. And that's where we feel the power of AI can really come in and affect the result of the treatment. So that's the presentation that I prepared today.
Thanks, Sam. Yeah, I'm actually want to buy one from you because now I have so many wearables to me, my wife, my parents. So yeah, and of course I know it's very difficult to get certificate, right, from FDA, right? So must be not easy journey, but congratulations for this. So there are some questions to you in the Q&A boxes. I think also touching the pricing information. Quite sensitive. Yeah. But yeah, up to you if you want to address privately.
Sure. Yeah, thanks I can answer that one. So yeah, just you want to talk about it now, or should I just?
No, we are running out of time. Please try to look at some question in the Q&A boxes. Yeah, thanks, Sam.
All right, thank you, everybody.
Thanks. Now I would like to introduce Professor Tori Fong, my friend in Hong Kong. He's going to share you about smart hospital with augmented pharmacy. So Professor Tori is also the CEO of Lead Flash Technology and also the vice chairman of expert committee of Shenzhen International Health and Senior Care Industry Research Center. Over to you, Professor Tori.
Thanks, Terence.
Yes, I can see your screen.
Yeah, thank you. Great for here. I would like to share my China National Entrepreneurship Project for 5G smart hospitals with augmented privacy. In China market, the pain point of the hospital information system, HIS, that's the construction and employment of here can improve the efficiency and quality of healthcare work. There are some unbalanced situation during development of HIS in China. The first is a long standardization of hospitals management. And second is a long sharing all the medical information. The last one is a late consolidation of software system development. We form in a China health system. In 2019, Smart Hospital Service Grading Evaluation Project is launched. There are total 17 grading for the evaluation. Here is a developed divided 5 groups. The first group is a consolidation service. This is include medicine appointment, first connection, referral service, and second one is consulting service. All the how to serve the information push and also the patient identification and revocation. The first is patient feedback, all from the patient after the clinic service or home service. They will leave some feedback for the doctor for the future support. And fourth one is the service of own process. That is possess some online payment and for the patient. Basically, it's go for the telemedicine to achieve their health training or intelligent medical guide. The final one is the fundamental of security. This is how to secure all the secret information go through the telemedicine and for the service monitor. Here is the healthcare solution overview. Ministry of Health MOH, they will have a regional health information network, and also the electronic health record can through the some elements to how to handle the 5G healthcare from the government. They provide the EHR system, private service, and medical collaboration, management research, and also the trust management. I would like to go through the trust management with the unmanned privacy later. And also they connect all the hospital in China through the IP, 5G IP, and also connect with the home care, township healthcare, and also community healthcare. Here is a private regional health care network products. In China, we already the 5G is very mature for the hospital system, but many other systems cannot connect with 5G. So we focus on use the access router with rich interface that can reliability access to basic level healthcare institution. Here is some several major problems of the building EHR platform. The first one is main consideration how to apply the 5G transmission. We need to provide a fast and reliable transmission. And also the second one, the storage problem. Basically, the large number of going of EHR system. So we need to some cloud system based on the some area or the whole country to centralize all the data storage. And also we need to AI to evaluate the big data, and the security should be stable and also secure. The last one is auto operation. We have to manage the multi-system, multi-service, or multi-vendor. Based on this, we have some solution to for the trust management here. The pain points of the trust management in China market. Basically, low standard trust in China, say for the Chui and PET. So they are hard for smart trust dispenser. From the overseas, we can import some from Japan, Korea, but their price is over $1 million per set. And also, the design cannot be suitable for the China market because all the just need to unpack and fill in the some box, but the boss is cannot prevent the humidity. So the other design from China is just vending machine. That's just the function is just to sell some padded just box to the patient. This is a huge just waste of the just, because all reminder just will be cannot be reused. And the second one is a smart pure box. With IoT features of smart pure box is very expensive, because this is include IoT function and also wireless function. And the last one is most of the China hospital is a manual dispensing. Here is suggested 5G amended primacy. There have 6 solutions. The first one is the dispensing machine. One receives the electronic prescription that can operate the dispensing function. And here is a amended vehicle and can distribute the pure box for the inpatient. And also we can do the recycle the pure box from correct back all the pure box. And we have also the cleaning bin. There is a UV function, heat function, and ultrasonic function, and also we apply some visual quality checking. And the major one is a 5G access router. Finally, one box can provide a self-collection that can be for the outpatient that collect the pure box from yourself and using the mobile phone, and also payment access. Here is our product launched in 2021. This product is a smart dispensing machine. We have got 17 patents and 32 awards in China. The major function of this smart dispensing machine is we can allow the pure with the package, like the bottle. Then we can get 1 pieces of the pure from real time. And also we have the precision cap. The precision cap can access all the different package of the pure. And the other function is that we use a triple just verification. We have 3 camera using the AI function to image recognition to check the pure. Is make sure the 100% for the dispensing in the pure box. Finally, we can put all the pures in the pure box. We have 3 pure box is for 1 day, 3 days, or 7 days. So the patient no need to dispensing any pures in your home, and we just follow the APP and the alert. Call him to get the medical. Here is the scenario 1 is for the clinic and hospital for the 5G development. Basically, we use our dispensing machine. Also, just say that is we can dispensing 1 day, 3 days, and 7 days. Go through the just the distribution logistic box. We can deliver all those the in-house and also outside. The patient, the outpatient is can self-collection. Collection your pure using their mobile app. Here is the scenario 2. We propose the 5G centralized dispensing and the tracking system. Also using our smart dispensing machine for the last mile. Is for example, we have 4 centers around the centralized area. We can distribute every day for the different patient drugs can through the logistic for the drugs distribution. Scenario 3, we also use a 5G small regional healthcare remote medical consultation. We will set up some dispensing machine in the last 100 meters, say for your home in the lobby. We can, through the APP remote medicine consultation, and then go through the APP and after consult the doctor, we can get the pill box from your home. Here is my public affair in China. I have total 16 affair in the China and also in Hong Kong, and also is my collection. Thank you to attend my presentation.
Thank you, Professor Torin. I think it's very interesting, especially when I collect the drugs, always need to wait 30 minutes to an hour. So I think this is really helpful for the efficiency on running the unmanned pharmacy. So again, thanks for your sharing. Hopefully more deployment will be also in Hong Kong. Yeah. So now it's only in China, right?
Yeah. Okay. I will go to the China. Let's win.
Okay. So yeah, there are some questions to you in the Q&A boxes. Please help to answer.
Okay. Let me see. Okay.
Yeah. Okay. So thanks again. So finally, we have a very good lineup of a panel. As I mentioned, we have a Southeast Asia panel from Malaysia and Singapore. So let me introduce James Lai, the moderator. He's also the chairman of Malaysian IoT Association, MIOTA. Hi, James. Over to you. You have to open your mic and let you to introduce the panelists, please.
Okay, hi everyone. First off, thanks Terence and Jessamine to invite me to moderate this session. So before we start with the panel questions, let me introduce our distinguished panel. First off, we have Ms. Viva Sheikh Farid. Viva has more than 2 decades of diverse experience in the healthcare industry. She has led various strategic engagement with internal and external key stakeholders to develop and drive collaborative initiatives in the areas of training, patient education, service provision, operations excellence, and digitization. As her current role is the Assistant Director in UCREST Berhad, her key role is liaising with the Ministry of Health of Singapore in the COVID-19 home recovery management. She is also shaping the strategy to enhance the company's presence in Malaysia, both Malaysia and Singapore market, to achieve an excellent global growth. She holds a master's in healthcare management from Griffith University, and she is also a trained advanced care paramedic. Right. Welcome to the panel, Viva. Next, we have Mr. Brian Bong. Brian is the co-founder and CEO of Smart Ops PLT that provides medical IoT platform for care providers to deliver remote patient monitoring services. He's trained in the hospitality and IT vertical professional. He has over 20 years experience in providing hospital IT project management and consultancy services. All right, welcome to the panel, Brian.
Thank you.
Next, we have Mr. Jesse Chui. He is an experienced professional in the ICT industry with a career spanning over 25 years in the areas of market research, industry analysis, forecasting, growth funding, and business development. In his current role at MDEC, Malaysia Digital Economy Corporation, Jesse supports the growth of high potential Malaysian digital technology companies, right, through engagement through the provision of market access, funding facilities, mentoring, and visibility platforms. Prior to MDEC, he was attached with Nielsen, IDC, and IBM. Next off, again, welcome to our panel, Jesse. Last but not least, we have Mr. Hudson Lee. Hudson comes from a background of connected healthcare industry and is the founder of IEME US, a health tech company. He devoted his time to the development and promotion of reimagined health ecosystem, connected singularity solutions for the health consumer, provider, and payer in facilitating new value healthcare expressions by caregivers and collaborating, incorporating his solutions through IoT, Internet of Things, artificial intelligence, and 5G technologies. Right, welcome to our panel, Hudson. Right, so I think for the past 2 years and until now, we are still in the pandemic. Hopefully it's ending soon, right? We have just seen a massive adoption of technology, right? Especially IoT. In fact, I think 2-3 years back, during the earliest stages of the pandemic, Malaysia IoT Association or MIATA actually did a joint event with GSMA covering how IoT technologies are being used to fight the pandemic. So applications like fever screening, social contact, geolocation, indoor geolocation of workers, assets, and so forth, right? There's more on the manufacturing space. I think the first question is for the panel is, how is the pandemic, again, we already know that pandemic is accelerating adoption of technology, but how is the pandemic accelerating the adoption of technology, specifically in the healthcare sector? I think for a start, let's hear some feedback from Miss Viva. Viva, you want to answer the question?
Hi, James. I hope you're able to hear me loud and clear.
Yes.
Okay. Okay. Of course, firstly, thank you for having me. Well, you start me with the first question, lady first. Okay, let me try to share with you how this pandemic have actually accelerated the adoption of technology. To begin with, I feel that because of the pandemic, it helps to decentralize care. So previously, care is always back in the acute setting. So because of the pandemic, we are able to decentralize it to home, and like what UCRES is doing, where we have actually IoT devices, which is connected to our mobile app. So that actually help physician to do a health services with our patients, and having IoT devices, to actually assist them in their diagnosis and care for the patients. So that is first how it accelerates, and patients are also more receptive to adopt technology because they understand the narrative of technology have changed. That is actually to enable them to get help to see a doctor. So that is also very important and vital. So two things. First, we are able to help patients, and at the same time, patients are also able to understand the use of healthcare. So I would say the pandemic actually speeds this process, and I really hope that this is to stay for the long haul. So again, it helps to decentralize care beyond the hospital. So, it's accelerate that. That's how I would say technology accelerate during this pandemic.
Okay, again, I think I agree with you, Viva. Overall, I think looks like the healthcare is also affected by the adoption. Maybe let's hear from Brian. I mean, what's your take on the same question? Right.
Yeah, thanks, James. I totally agree with what Ms. Viva has mentioned. The pandemic has sort of forced decentralizations of care. A lot of patients would prefer to be treated at home if at all possible, Likewise, I mean, my parents, if they can be treated at home, I would prefer it that way as well. So I think because of that, I think we see a demand for getting IoT devices to the home, for monitoring by the doctor. So that sort of push the adoptions of IoTs, as part of the hospital at home kind of services, especially I think notice the big progress in Singapore. I think Malaysia, we're also seeing it. We're also talking to telehealth companies that is implementing that. And also even nursing home companies also looking at that for now. So it certainly has helped to progress the health IT implementations in the country because of the pandemic.
Well, a follow-up question, Brian. I think you mentioned that looks like a lot of your clients, for example, in nursing home hospitals, are looking into and adopting your solutions. What about the end customers, the patient themselves, especially the elderly and the aged? Are they more receptive right now to getting wearables?
I think we are not really into wearables. We started with that quite a couple of years ago, because I think wearable, why we find that disturbing is for the patients. Imagine that you are 70 years old and you are asked to wear a watch 24 hours a day. I don't think it's going to happen to a lot of people. First thing, do you like the design of the watch to start with? And then is it comfortable for you to wear it nearly 24 hours a day? I play with that. I lasted one night only, the next day I just put my watch away, and I'm not going to wear the watch for when I sleep. So we're not really into that. We are more into the usual blood pressure monitor, oximeter and all. But I really like what Sam has mentioned earlier, that that you don't have to really weigh those stuff and then you can monitor. But of course, the challenge, that is a different challenge. Yeah, thanks.
Okay.
You're mute, James.
Let's hear a bit of feedback from Jesse. I think, Jesse, you deal with a lot of digital companies, especially startups, especially in Malaysia, right? I mean, what do you see? I think pandemic is accelerating a lot of adoption of technology. From the agents MDEC perspective, right? What trends do you see?
Thank you, James. Yes, certainly the companies that we have talked to, the health tech companies, especially those involved in telehealth services, definitely have reported a big, right, in terms of the activity level as well as their own company growth and revenues. And also they see much opportunity to actually give relevant feedback to government authorities in terms of how the healthcare landscape is changing. Right, and I think this conversation has been going on, especially with the healthcare ministry, right? Even before the pandemic started, right? I think the government is already looking at, how can we maintain health provision of healthcare quality, right? Whilst optimizing or strategizing healthcare costs. Certainly, healthcare cost is a big chunk in the government's annual budgets. And I think the government is very open to work with the startup community, the tech community, in terms of creating more opportunities to see how health services, particularly from the public side, can be delivered via technology. So yes, I think, and one of the things that the companies also gave feedback to us was that with the growth in IoT and connectivity, right, there will be proliferation of medical data, right, from the citizens and from wearables and so on. So I think now the question is, how can we harmonize this data? How can we remove the islands of data that's being captured by different healthcare providers on one end, and the other end would be how can we then secure this data, right, once it is open, once it is shared. So these are thoughts and these are opportunities for both the government and the private sector to collaborate on.
Okay. Well, I think Jesse, since you brought something up on data, I have a follow-up question for you later. But let's go to our last panelist, Hudson. You have anything to add on as regards to the first questions, right? How is pandemic accelerating adoption of technology in healthcare?
Like what was shared, that the pandemic actually created a degree of awareness and appreciation for the technology, which otherwise, in the absence of that, it's going to take many, many years more for the technology which is in place to be used by the population and the healthcare provider. So that's the plus point. But I suppose for all of us, for all the stakeholders, is how we apply the technology, what sort of value. And it was mentioned that adoption may be a problem because in the absence of motivation, patients, providers all need to be motivated. It's more than just a BP set or barometer or whatever that may be. So we are looking at the broad. If we look at the what comes beyond and after IoT will be probably the next way of looking at it. Yes. So for example, how do we define healthcare? Is it just capturing a vital sign or see a doctor when we are sick? There was earlier one of the speakers mentioned about prevention, proactive. How does the technology, 5G, IoT, and all the rest come into play? So these will be some of the interesting areas. But bottom line will be the motivators that drive the technology. Good to have. There are lots of technology in place today, but sad to say, we are far from optimizing our value propositions. So that will be challenged, at least for me, and people, like-minded people, to work together towards that direction. Yes. That's how I see it. Yes.
Okay, great insight, Hudson. I think I want to add to that. I think due to the current pandemic, we see a lot of cases on mental health, right? Yes. I think healthcare itself, we probably need to explore again, define again, other than measuring blood pressure, heart. I think mental health is also an important element, right? That we need to find ways to measure using technology. I think coming back to the healthcare industry, I think one of the major challenges, especially for startup, like you, Brian, Hudson, right? I think also Sam, our speaker, who produced an excellent device, is the regulation, right? Healthcare is being one of the most regulated industries, right, globally, right? For example, for medical devices, to get it to be used for clinical use in US, you need FDA approval. And I think each country has its own so-called FDA approval-like process, right? Could be tedious, and actually it could increase the overall cost of the solution. And also, there's a lot of countries practicing data privacy laws, especially in the healthcare. We're dealing with both physiological data and data that belongs to patient records. So my question is, what is the difference that you guys see in terms of regulatory, right? Is it more stringent? Is it more lax? And the use of data before and during the pandemic, right? So maybe let's hear from Jesse. Maybe you can explore and what you mentioned about data.
Right. So, Jace, you were asking the question about is there any difference between
Yes.
the regulations before?
Actually, I'm from the government
pandemic?
Yeah.
Well, I think definitely the government is looking seriously at the regulations and how it can be improved to accommodate these new developments in technology, right? And the government is very active in terms of collaborating with the private sector through various means, especially in Malaysia. We have the National Technology Innovation Sandbox for a start, where the various solutions from the private sector can be brought in, and relevant government stakeholders can then be involved in its so-called experimentation, its impact, and also on the regulation side. So the other laws, of course, apply, such as the PDPA Act, and also the Telemedicine Act, And these are basically some laws, which need to be looked at in order to enable widespread adoption of, say, remote healthcare and patient monitoring and the hospital, as we call it, or hospital concept, right? So it is all in line with what the government is driving towards, right? Which is to re-optimize the cost of public healthcare, especially, right? Without compromising the quality of healthcare delivered to the citizens. So if you ask me what's the difference, I think the key learning here is that there's a heightened awareness to look at regulations and how that is an opportunity really to facilitate, to change and to facilitate the adoption of technology. I think we've all seen in this afternoon's amazing presentations by Vodafone and by Sam, and how technology actually is changing the boundaries of how healthcare can be delivered. So I think Malaysia is no exception to that, and I think if anything, the pandemic has certainly raised the bar for us to respond, both from a regulation standpoint as well as from an implementation standpoint.
Okay, thank you, Jesse. So Viva, I think you are exposed to both Malaysia and Singapore markets, right? So,
Yes, that's right.
So what difference do you see in terms of the regulations, the use of data, stuff like that, during and after the pandemic?
Right. So I actually echoed what Jesse says is true. It kind of forced, I mean, working with two different countries, it forced the government to look into the regulatory to make it, to hasten them. So even in Singapore, we have like a special access route being created. We do have the regulatory sandbox that's already been done. So basically it accelerates again because of the pandemic. And again, I will always think that data eventually belongs to the patient. Patients are the owner of their own data. So I think that is very important. Even whatever data that we have to actually narrate it back to the patient that this is actually belongs to them. They have the control and autonomy of it. And we are just an enablers of their data, where we just want to ensure that with the right data that they have exchange using IoT devices per se, or even like uploading informations on the mobile app, any of those sort, it still eventually belongs to the patient. So those are the things and narrative that I believe that have to actually, re-educate the patient so that patient understand and very much self-aware. And when the patients take control of their own data, it also means that they take control of their health, because they are more responsible. If they have a control of their own medical data, medical report, they would be more responsible of their health. And then again, back to the part where, everyone was talking, all the speakers were saying about, doing proactive management of, care. I think this is all relevant. It's actually all intersync. So back to my response is, I agree, because of the pandemic, regulatory bodies are actually having to force to look into things quicker and faster.
Okay. Anything to add, Hudson?
I'd like to add to the point that I agree, Viva, that ownership will be something to look at, ownership of personal data. There's much talk about personalized healthcare, stuff like that. And earlier on, one of the speakers mentioned in one of the slides, we are taking a view of metaverse. Imagine we achieve a working degree of metaverse tomorrow. What happens to who owns our data then? Will it be an authority or group or a personal? And if it's all fragmented, where and who decides what goes now? So I suppose it's all the answer will be very evolutionary. We need our time. We need to bump our heads a little bit, like everything new. But it'll be a very interesting thought when we look at it a little bit further down the road. Yes.
Okay, I think if we gonna discuss about data, I think we'll take a much longer session, right? I think I read somewhere that if you sign up for a free service, for example, Facebook or YouTube, right? You give them the data, the product is you, right? It's free, but you are giving away your data and you are the product. Any last thoughts, Brian, on the data regulation, protection, and so forth? Brian, we can't hear you. You're on mute.
Okay, sorry. Data is quite a tricky thing. I mean, all of us say, yes, the data belong to me, but trying to go to a hospital and say, can you send me the data, and then, you know, in the format that I want, to my handphone or something, you can forget about it. You probably print out a hard copy, 5 pages, and you pay 100 ringgit for that. So that is one of the key pain points when you have to go for second opinions, you know, and you know, bring the parents to a hospital and ask the medical histories and all those things. So if the regulatory framework, like the government, can somehow say that yes, your data belong to the patients, and this is a repositories, a patient has a right to say, I want you to park your patient's data and share certain data here, for example, lab results and radiology reports, which are the crucial ones, and maybe discharge summaries if there's any admissions, some key data. That would be fantastic for the folks, you know, for the patients to running around from one hospital to another, but that's not really happening yet. But having said that, I just attended a session by Ministry of Health this morning, together with they are in partnership with Future Rise, to talk about the regulatory lab sandbox. So it's launching tomorrow. Actually, if you have anybody interested, you can actually sign up tomorrow to participate in the sandbox to talk about Malaysia, you know, healthcare, what do you call it, healthcare organization, SCO, what they call it, SCO. Basically, those telehealth companies, hospitals can actually join in to shape the whole regulatory framework. But having that, they expect to sort of probably complete the whole sandbox in 2 years. By the time you finish, you pass to the parliament to approve the act, probably another 3 years. So I'm not sure that this is like a, you know, playing catch up all the time. And then for us doing medical IoT, the challenge is that you can't, there's not enough we call that standards or guidelines in place to say, okay, can you do this, can you do that, and things like that. And also the ministry also acknowledged that because of the pandemic, that there are a lot of telehealth companies mushrooming, you know, coming up, and then the act they have, which is Telehealth Act, is not sufficient already, and they acknowledge that, which is a good thing. That's why they're coming up with this sandbox to, you know, to try to manage it. Yeah, it's a long way, but it has got started.
I think it's good. I think everyone agrees that the government is listening, right? I think we just need to engage them, especially educate them on the technologies, the roadblocks that digital companies face, and then feedback to them in order to influence changes to the regulation.
Yeah.
I think we have a question from the audience. I think the question is that, what happens if the company who is the custodian of your data goes bust and they sell those so-called assets abroad? Will still patients' rights apply? Any one of you guys want to take that? Maybe Jesse from the agency side.
Well, as you know, currently all data that we give to healthcare providers stays with the healthcare providers, and they only share a certain amount of data with the ministry, right, for analysis and reporting purposes. So certainly, if there's any breach of data, right, from the healthcare provider, then definitely the PDPA law will apply in this case. So, so when we talk about data sharing or data exchange between healthcare providers, so definitely this is a new area. In fact, it's actually not new. Other countries have done it. For example, like Taiwan have a very robust data sharing infrastructure. So, so if we were to create this health information exchange, right, then certainly some new regulations need to be put in place to ensure privacy and security, for example, right? So as I mentioned earlier, cybersecurity is, in fact, because of 5G, cybersecurity is going to be even more important moving forward when more and more data is being collected through devices, and more data is being exchanged, between healthcare providers on an anonymized level, for example. Yeah. So adding to the question. Well, I mean, if information, of course, today is gold, right? Is as we always say, information is the new oil. So certainly, the regulations. Again, the question comes back to regulations here. For now, it is still the PDPA Act in Malaysia, but I think moving forward, there will need to be enhancements, and exactly that's why MOH is working closely with Futurize on this aspect. To try and tackle. It's a complex subject for sure. I think those of us who, especially who provide hospital information systems, for example, can appreciate the complexity of data and its integrity.
Okay. I think we don't have a straightforward answer, right? So I think it really depends on education the patient themselves on what is their rights in terms of data protection, and obviously the consumer need to maybe do a background check on the company, right? That they sort of like give the data to, or a custodian for the data. Anything you want to add, Viva or Brian? On the question?
I just want to add something about this, because again, I agree this is a very sensitive topic, but yet I think it's never going to be one straight answer, because even in the banking industry, you do have threats and cyber attacks to those patients' data and information. So it's same as healthcare is vulnerable, but then again, it goes back to how the infrastructure of the company, your data architecture, how it's being done. So when those things are in place, as according to what government is requesting from the setup of this data structuring, I believe that, that's one of the ways we can actually circumvent this, and we can navigate this situations, because I guess this is going to be always a problem, data breach. But if you're going to just look at this problem, we will never move up, because we are just going to be held back with this. Instead, we should come up with solutions to navigate it and overcome this. This is going to be an endless conversation about data breach. Yeah.
So Hudson, Brian, you got anything to add on how to navigate, as Viva mentioned, through this scenario? Brian, are you
okay. So I mean, for our kind of solutions, remote patient monitoring solutions, one of the way we try to navigate that is using a digital ID. So meaning that the data that we put in the cloud would not contain the actual patient's like name, email address, whatever. So it's just a string of numbers then attached to, let's say, vital sign information. So again, it's a string of numbers. So in that sense, even in the worst case scenario, we got hacked, someone take the data, it's just statistic data. You can't pinpoint that to anybody. So but having said that, those numbers, digital ID, when linked to the hospital site would be able to know who it belongs to using some kind of matchings and hashing, unhashing kind of crypto kind of algorithms. So this is how we navigate sort of around it.
I think there's the same feedback from one of the audience saying I think we can anonymize the data, right?
Yeah, this is anonymizing the data totally, but we do not. The first thing is that we try not to collect patient information, meaning that I don't want to know you are James and your IC number and all those things, but you are using some kind of digital ID to identify you are James. So
when they got the report, you don't know who it belongs to, right?
Yeah, I mean, you got the hospital report, of course, physical report, It's just that when you log into your accounts, you use a digital ID, a QR code, and things like that. That ID your private key for the access is actually on your handphone, for example. So only you can access that to let's say to view your health records, and also the hospital using some kind of crypto style kind of encryptions. So,
okay, I think due to the time limitation, Terence, do you have more time for the last question?
Yes, you can have one more question.
Okay. So I think this is the main theme for this is how IoT and 5G advance new applications. So basically the question is that I think we heard quite a lot of very innovative, interesting applications powered by 5G. Right? To all the panelists, maybe you guys give some thought on based on the 5G technology understanding, right? Which areas will you be working on, or are you really using 5G in some of these areas? Maybe let's start with Hudson.
5G is of course a necessary component. In answering, maybe I also share a little bit about how the earlier views on the data per se. Historically, we have been looking at data from the provider end. Until now, it still is, but technology like IoT, 5G, AI, and all the rest that's coming along the way shifts that perspective, allowing people like you and me to take a more significant role in health as a whole. Now, we leave ourselves the day we are born to situations whereby when we are sick, we see a doctor. At the best, we take some vitamins and do what needs to be. But today's technology allows things to be different now with the implementation of AI, better connectivity, of course, more conversations, more narratives. If we take a perspective of, let's say, for example, James, you ask yourself, are you getting healthcare as a whole throughout your life until now? No, we don't. Fragmentation is the biggest cause of our problems. All of us, all of the best minds in the world, think of the best designs and talk about all the latest. But the more we evolve and produce, the more disconnected and more silos we create. Imagine the horror of 1 million scientists come out and 1 million discoveries, and they don't speak to one another. So there is a need for us to collectively sit together. We may not have the answers today, but step by step, we'll get there. And there's a need to take things from a different perspective. And personally, I feel it's not with due respect to all the authorities and all the, with all the good intentions. Which country in the world has the level of healthcare that every one of us deserves, whether we are rich or poor? We don't have it yet, but I'm very optimistic it's just around the corner, because what I saw today was enormous, and what I heard too. So if it's going to happen, it must come from each one of us. We may be a person, we may be a provider, we may be a payer. So many a times we are talking about patient centricity, but if you take away the word patient and exchange it for person centricity, then you answer a lot of questions, including the privacy, the ownership, the legislation, many more to come. Of course, we need more time than what we have today. We can have a conversation again later, but it's going to be very, very exciting for sure. Yes.
Okay, I think Hudson, I agree with you. I think with the current technology, especially IoT, 5G, or even AI, right? We have enough resources. The technology can be utilized to do prevention, right? Prevention is better than cure, as the saying goes. Viva, you have anything to add in terms of what are the interesting 5G new applications, right? That your organization might embark in, or will see more innovation out of it?
So I would say that 5G definitely enables us to do more. In fact, I see it as a lot more potential, as like I mentioned earlier, connectivity devices that we are able to link together with our app, so that we are able to basically came out with this cloud hospital, and that's what we are actually able to transcend healthcare, which is beyond the hospital. We always believe, I mean, I agree with Hudson. I mean, at the end of the day, we are looking at cutting costs of healthcare. So when you look at cutting costs of healthcare, this is one of the ways. I mean, it's probably is minute, but it's just one little way that we are hoping to achieve it, by making sure that patients have, early intervention of their chronic disease. As we know that in the population today, perhaps, every one of us, when you reach a certain age of 65 and above, we are probably bow down to one chronic illness. And if you are unlucky, I would say maybe 3. But again, when you have an early intervention, and by using devices like, IOMT devices, or even a EMR to capture your patient data, you are actually hoping that your disease doesn't accelerate to something much more serious, where it required you to be in a hospital. So again, when we look at how 5G can play a part, I would say, to those answers, we are hoping that eventually costs and burden disease are able to be reduced with the innovation of 5G, and of course our service.
Any other feedback from?
I guess I'm a little bit more optimistic than Hudson.
It's good to have different perspectives. Any anything to add, Brian?
Yeah, I think the immediate benefits of 5G that I can see is, is for the specialist hospital, especially in the Klang Valley in Malaysia, to help out those district hospitals outside, in Sabah, Sarawak, Sarawak is where I came from. Because I used to see doctors in Cebu hospitals trying to transmit like MRI images or CT images that takes the whole night, if the line don't drop, for the image, get a second opinion from Sungai Buloh Hospital, for example. So I think with 5G kind of things, and now they can not only transfer the images so fast in seconds, and then they can discuss the case together, because of the bandwidth is there. So I think that will be the immediate benefits, that I can see. Of course, my solution, we were quite happy with 4Gs. 4G is available, but 5G is really for huge volume of video data, unless we're talking about millions of IoT devices. And also for specialists in the Klang Valley to use those smart glasses to help out, like what Dr. Shafid has shown in a district hospital or the small hospitals outside Klang Valley. That would be excellent. Yeah.
Okay,
that's my take. Yeah.
So it looks like an ideal application of 5G would be a metaverse hospital, right? Or metaverse home hospital, right?
Yeah. Also, it'd be exciting to see application of 5G and IoT map against a person's lifetime plan, a health plan for your life. The day like they mooted our Malaysian telemedicine 10, 20 years ago talked about lifetime health records. Now is the time we actually revisit that and see what we can do about it. Yes.
Okay. Any last thoughts from Jesse?
Interestingly enough, speaking of Brian, was talking about metaverse. In fact, there's a UK non-profit organization called The Health actually just announced they're going to create the world's first healthcare metaverse, where entities, whether providers or individuals, can exchange anonymized healthcare data with one another for a health token, for example. So, I mean, there's not much information about it, but I think that goes to show that people's imagination are really running ahead, right? Technology and I think one of the slides with which Dr. Safi shared earlier, healthcare or health is the one area where all these technologies converge, right? And so I think, yes, I think to Viva's point, yeah, definitely the technology will have a lot of possibilities moving forward. So I think it will be a challenge for governments and regulations to keep up, lah.
Okay, I think there's a lot of great things that's coming our way. I mean, technology-wise, I think that's why they call it the coming of the fourth industrial revolution. I think we are at the end of our panel session again. On behalf of GSMA and also myself, I'd like to thank all our distinguished panels to taking the time off to give the feedback. And before I hand over back to Terence for closing remarks, I would like to take a wish everyone a happy, belated, prosperous, and healthy Lunar New Year. Right, back to you, Terence.
Thank you, James.
Thanks, James. Thanks, everyone. Really great, a very great panel discussion. We hear a lot from the Southeast Asia experts. So really looking forward. This is just a beginning, especially with 5G coming in Malaysia and launch already in Singapore. I believe there will be more and more innovative use cases. And of course, we definitely need government support. Otherwise, we just can't do anything. So hopefully, government will provide full support to have a breakthrough on the transformation in the healthcare sector. So I just quickly share you the next. So as you know, we are a community evolving. Please join us. We have a monthly activity. So next we have Barcelona, and then we will publish some case study about APAC innovation. Of course, the case studies is open. So if you have any innovative idea or you're already doing something on 5G IoT, please reach out me. And then for March of 17, we also have manufacturing workshop. So in case you are not only doing on healthcare, but also providing different kind of support or working on manufacturing sector, welcome to join us. Thanks again for every one of you. Thanks your patient insight. I see a lot of questions in the chat box, and also we are very happy to continue the discussion. So please join us. And also, I think most of you are looking forward for the presentation material and also the recorded session. So once we got approval from the speaker, we will share to all the attendees. Thanks again. See you next time. Bye.
Thank you. Bye.
Bye.